it's Mir Aubuchon at MCRM Fertility, part of the First Fertility Network, for this week's Fertility Foodie. I wanted to do a segment on Endometriosis Awareness Month. We're closing out Endometriosis Awareness Month, and not everybody knows what that is. So I wanted to do a demonstration. Now, unfortunately, food can't cure endometriosis, but it may improve some aspects of it, and certainly by eating in a healthier way, endometriosis can be alleviated a little bit and perhaps fertility may improve. So I'm going to go over what happens when people have just a normal menstrual cycle. So what I've got here is I've got a red bell pepper, which is the uterus. It represents the uterus. I've got some celery, which represents the fallopian tubes. And in these containers is a kind of it's a lentil called Uradal, and I'll spell it because not everybody has heard of it. U-R-A-D and then dal, D-A-L. It's an Indian kind of lentil, and it can be a very good source of plant-based protein. So what happens in a normal menstrual cycle is the uterus has a lining, and the lining comes out along with menstrual blood every month, and that's what starts the first day of the period. And usually the period is not all that, bothersome to people. And so I'm depicting that with some ketchup, and tomatoes are an excellent source of antioxidants. Now, normally what can happen is because the uterus is connected to the rest of the pelvis by these fallopian tubes, what happens is some of that blood will come out, but then some of it will flow backwards through the fallopian tubes and into the pelvis. Not that big of a deal. It just gets reabsorbed by the body. No harm, no problem. Ovaries, no, are not any the wiser. Now, for some people, instead of just plain, just bleeding and it's a little bit annoying, they may have a little bit more symptoms. This is some hot sauce, but it's mild. So it might be, maybe they need to take a little bit of medicine, but still not really much of a big deal. Then we start to get a little bit more, where now we're probably one of the symptoms of endometriosis that doesn't happen in everybody, but it can happen in some people, is just more painful periods. Hot. And in them, what's probably happening is some of that menstrual blood, the characteristics of that material is a little bit different, and the body tolerates it a little bit different in an endometriosis patient. That fluid comes out, and that can cause a little bit more issues for the person when it comes out of the fallopian tubes. And that may give them a little bit more pain than usual. But then we have some people where it's so much more than that. It's like fire. And so in those people, what can happen is when that liquid comes out, the body, the steps that the body has of getting rid of the blood after it comes out can also be dysregulated. And so what can happen is that can start to affect the ovaries. If some of that gets onto the ovaries, and sometimes those people can start to develop cysts on their ovaries that contain blood, which is strawberry, and there can be cysts within the ovaries that can do that. If the blood within those cysts sits around long enough, that starts to collect, and during surgery, the cyst material looks like chocolate. This is a chocolate covered dark chocolate covered freeze-dried strawberry, excellent for health, but you just can't eat a lot of it because it's highly caloric. But that can go into the ovary, and unfortunately, you get enough of those in an ovary, and it really starts to take up more of the space in the ovary than what is healthy. And in those people, sometimes we can start to see a condition called diminished ovarian reserve, where the egg supply starts to go down. We might be able to see that on an ultrasound when we see fewer follicles on an ovary. If there's enough of this inflammation all around, what the body does is it starts to heal itself by forming scar tissue. That can be a good thing, but in the case of the pelvis, that can actually be a little bit detrimental, and that can start to glue surfaces together. This is some food grade cling wrap. The celery leaves are what sort of the very fingers of the fallopian tubes look like, and they function by getting an egg. They pick up the egg. That egg sits at the very edge of the fallopian tube for sperm to come this way to meet the egg. And what can happen if there's enough inflammation is that these surfaces are just all scarred up. It can start to even affect the position of the uterus. All of these positions start to get impacted. Such that sometimes even the ovaries are so close together that it almost looks like everything is touching one another. And now it becomes very clear that it's not just egg supply and it's not just pelvic pain, but now the sperm and egg really can't meet. Nothing really works because everything is off. And for some of our patients, they have no symptoms at all. And so there's not really a diet to fix that, but there can be surgical procedures or fertility treatments that may help to get around some of these issues, to free up the scar tissue, to restore more normal anatomy. Depending on the severity of the scar tissue, perhaps all the normal anatomy can be restored. The cysts may be able to be removed. At least to some extent, maybe a little bit gets left behind. There's not really a cure for this, but in doing so, that may change the whole menstrual cycle to be much more normal. And the person can start to live their life properly again. It's a really difficult disease, and I wish we had a cure for it. But hopefully this at least gives our viewers a little bit of an idea of what goes on with it. The reason that I showed this diet is because this diet is very good at protecting the health of our cells. And with endometriosis, there's a lot of cellular damage that goes on. And even small steps toward healing them can be beneficial. So until next time, I'm not going to do a chef's treat today, but we'll do it next time. I wish you all well. Bye now.